Hi, my name is Shani Quevedo. I'm an internal medicine resident at HCA Florida Aventura Hospital. The title of our case is Eosinophilic Enterocolitis, improved after breast reduction. Hypereosinophilic syndrome is a disorder characterized by an accumulation of eosinophils within the peripheral tissue or blood, with varying manifestations dependent on organ involvement. Eosinophilic gastrointestinal disorders, also known as EGIDs, is one such manifestation. In the case of our patient, we believe that the antigenic leakage from the ruptured silicone breast implants was the cause of her symptoms. Our patient is a 59-year-old female with a history of asthma who presented with new-onset sharp epigastric pain that was worsened with oral intake and had associated diarrhea. She was recently evaluated at another hospital for leg weakness, and at that time, peripheral eosinophilia was found. Electromyography also showed chronic inflammatory demyelinating neuropathy. She had a full diagnostic evaluation for HES at that time. However, by exclusion, she was diagnosed with idiopathic hypereosinophilic syndrome. She was treated with low-dose steroids, IVIG, and plasmapheresis. However, she did not have significant clinical improvement. At our hospital, her labs revealed a leukocytosis of 35,000, an eosinophilia of 21,960, and an IgE of 1,299. A workup for hypereosinophilic syndrome was repeated, and it excluded other causes. A CT abdomen later revealed wall thickening of the descending colon and intracapsular rupture of the right breast implant. An enteroscopy also demonstrated erosions and ulcerations of the duodenum and the jejunum. A colonoscopy later showed focal ulcerations with surrounding inflammation separated by normal mucosa. The histology for that demonstrated eosinophilic infiltration throughout the colonic mucosa. A video capsule endoscopy that followed also demonstrated diffuse inflammation and ulceration of the entire small bowel. She was treated empirically for strongyloides before starting a course of high-dose prednisone therapy. A month later, her breast implants were removed elsewhere, and shortly after, she was successfully tapered off steroids with complete resolution of both her GI symptoms and lower extremity weakness. We had her follow up on an outpatient basis, at which time labs were repeated and showed normalization of all lab work. Eosinophilic gastrointestinal disorders are multifactorial. However, they have a strong emphasis on immunologic factors. Eosinophilic infiltration is seen on biopsies, and exclusion of secondary causes of infiltration are required for appropriate diagnosis. Treatment is aimed at symptom management and removal of offending agents. In our case, our patient experienced complete clinical resolution after the removal of her silicone breast implants. Our case highlights a rare case of eosinophilic enterocolitis that was associated with a ruptured breast implant in an otherwise healthy patient. This highlights the importance of remaining vigilant of all external factors that may have been contributing to the pathologic process in this patient's case. Hi, my name